Hello and welcome to the Caring Matters podcast. I'm Liz Tassone, the volunteer host, and I'm here today with Sharon Kowatch. Sharon is a nurse practitioner, and she also has specialized training from the University of Pennsylvania in geriatrics as well. So she works locally here, and she is a nurse practitioner, sees patients. And in part one, we talked about how a caregiver or an older adult might best prepare for a doctor's visit. And in this one, Sharon, we wanted to talk about that visit itself and kind of the best way to be during that visit to, kind of get the most of your bang for your buck, but I think you're going to tell us differently in terms of how to get, the reason you made this appointment, how to address that problem. So first, let's talk about that. I'm going to call you. My mom's has a sinus infection. And so I'm going to call your office and I'm going to get her set up for that. And while I'm in there, I'm also going to add that her knee's been bothering her and her big toe kind of tingles. Tell me about that. I want to get all those things covered in one visit.
Well, I think one of the things that I talked about in the first part is the importance of having a once-a-year comprehensive evaluation. And it really is at the comprehensive evaluation appointment that you would go over a list of items that have been bothering you over a period of time. When you call the physician's office for an acute illness, and a sinus infection would be an acute illness, a new onset of joint pain would be an acute illness, having a fever, possibly developing new onset shortness of breath. These are all reasons that you would call a physician's office with an acute problem. When you come in with those problems, you want to limit the visit to just the problem. If you bring in other issues as well, it will dilute the original problem and the attention to the problem. Physicians, when you've scheduled that appointment in usually a 15-minute time slot, and that is really only enough time to take care of one problem. Physicians are getting more and more pressure to stay on time. They're getting complaints from other patients who say their time is as important as your time. And to address multiple problems in an office visit that is designed to just address one problem is always problematic for the physician, and there will be cursory attention to each of the problems.
Okay. So what if you do have two issues? Can you get in for both for that sinus infection and the thing? Would that be a longer appointment, or would they say we're going to talk about the acute problem, the sinus, and make an appointment down the road for the other? How might that work?
Well, my experience is the person who comes in with the sinus infection and the knee pain has had the knee pain for quite some time. So what makes more sense is when you develop the knee pain and you feel it needs a physician's attention, then you set up an appointment for the knee pain.
Okay.
When you develop a sinus infection and it needs a physician's attention, you set up the appointment for the sinus infection.
Okay.
Now, I will tell you that most physicians, if you came in, if you had a sinus infection and then knee pain, and it really did need to be addressed, the physician would, or nurse practitioner would then address both problems. They would run late for the rest of the day, and they would spend the rest of the afternoon listening to other patients complain because they're not running on time. But
Okay.
they would not ignore the problem, so to speak.
See.
Does that make sense?
Yes. But out of respect for what their day's like too, if you can give attention solely to the reason you're calling, that might help.
The exception to this rule is there are some patients who will call in with, quote, a simple problem. And when they get into the office, it's not a simple problem. The reason it's not a simple problem is because they didn't realize it. Okay. And in that instance, the physician will spend more time than what is allotted for the office visit to deal with the problem. And that is often the reason physicians and nurse practitioners run late. And so that, if you're waiting for a physician and it's been an hour, often that's what's come up, is the patient didn't realize the problem was as serious as it was.
Okay, good to know. What about getting to know your doctor or your staff? How does that help in terms of, how do you see that playing out as a nurse practitioner when somebody knows you?
I think that that's a really important question. It is very important that you get to know the staff in the physician's office. And in today's world, there is physicians and there are nurse practitioners as well as office staff, trained nurses in the office. Your nurse practitioner is someone that you can see that has a slightly different training, and it is a broader training, some attention to activities of daily living, attention to community resources. So if you have a need for for consultation in some of these areas, consider setting up an appointment with a nurse practitioner.
And you can write prescriptions
Correct.
as well.
Correct.
Right.
In the state of Ohio, the majority of the state, nurse practitioners can write prescriptions just as physicians can write prescriptions.
Okay.
Another office staff person to get to know is the office nurse. In our office, the office nurse knows the older individuals, knows them well, so that when a problem arises, they understand exactly why it's a problem for that particular patient. And so it's very useful to get to know the office staff.
Okay, very good. What about that appointment itself in terms of, I think, when I think about a caregiver bringing an older adult into the office, I think about, sometimes a doctor or nurse practitioner is talking to you and then you walk out of there and you go, what did he say? What did she say? So do you have any suggestions in terms of remembering what people say? Do people ever come in and take notes or record or something like that?
I would absolutely take notes. And I don't think that I would be surprised if there was a healthcare provider who had a problem with someone taking notes. And I often have patients take notes, and I also spell words for them if they don't understand exactly what I'm saying. I will tell you that most healthcare providers feel uncomfortable being recorded, and it has to do with legal issues. We're fairly sensitive to attorneys and what they can have their perspective on things. It makes us can make us a little nervous, and that is why you'll find physicians and nurse practitioners very uncomfortable to be recorded.
Okay.
But taking notes is essential.
Well, I like your idea of spelling things for people, because I think about, if you've come away with a diagnosis of like hyperglycemia versus hypoglycemia or something, I don't even know if that's a real term, but it's like there's so many words that are really close. So instead, if you said hypo and I heard hyper, and I go home and I research everything about the wrong thing, I can do myself some damage. So just that whole aspect of, clarity and even writing things down when you get a diagnosis. It's a really good idea.
Diagnosis, test results, understanding those test results, lab work. Ask for a copy of the lab work. If you don't fully understand, ask a copy of the lab work so you can go home and have a family member read a little bit about it.
Yeah. We love those family members that are part of the medical profession, because they get asked a lot of questions.
Yes, that's very true.
Yeah.
And they don't mind. For the record, they don't mind.
I've got a sister that's a nurse, and it's like she gets everything from, all of us. She has to be our consultant when it comes to that. So but that's part of your training. So you're like glad to be the person that can give some interpretation of the doctor's orders or diagnosis. So
Exactly.
That's helpful. That's helpful. Is there anything else you can think of actually as part of that appointment that might stand out for a caregiver? We've got the non-dilution of the service, and we've got either taking notes as a way to confirm when you get diagnosis. You said we can ask for copies of
lab work,
results, if that would be helpful. Anything else that comes to mind and getting to know the players, getting to know the people.
And again, bring a list of medications to every visit.
Okay.
So that it can be compared and ensured that it's accurate at every visit.
Okay. Important stuff. Sharon, thank you so much.
You're quite welcome.
This is just good stuff to have, and I think people don't necessarily go into an appointment with this same idea of how to prepare and how to be in that appointment. So it's important for caregivers to hear, because a lot of times they're the ones that are bringing people to the appointments. And what about you in terms of that caregiver who's in an appointment with an older adult? Is that something that you, as long as they're with them, you can always consult with them, or do they have to sign the HIPAA agreement to talk with them, or do you assume if they're actually accompanying in the office that it's, just curious about that.
You actually bring up a very important point. One thing that I think you'll find that there is some variability among healthcare providers is whether or not they like another person in the room in addition to the patient. And all of your geriatric trained individuals insist that the other person be in the room. So for example, when I see any older individual, I always want the spouse in the room as well. Often the nurses will put the patient back in the room and leave the spouse in the waiting room, and I'll call the spouse in. Because I think it's important for the spouse to hear what I'm saying so that there are two sets of ears listening to it. Yes. And also, spouses tell me things that patients don't tell me. And so I really like to have them in the room. In terms of the caregiver HIPAA, if you are in the presence of the patient, the assumption is made that there is consent.
Okay.
And so there's no HIPAA requirements when you're in the presence of the patient.
Okay.
So all doctors' offices do have a piece of paper that you can sign. It's very important that you sign this piece of paper. It allows us to leave information on the answering machines. It allows us to give information to spouses, to children, to siblings, and so forth.
If they're listed on
They have to
thing.
be specifically listed in the office as an individual that the information can be given to.
Great. Great information, Sharon. Thank you so much.
You're quite welcome. It's been a pleasure.
I'm Liz Tassone. I want to thank you for listening. I also want to mention our sponsors to this site: Vitas Hospice, Hillebrand Home Health, Home Care by Blackstone, Family Bridges Home Care, Lifespan, and Bailey. Thank you for listening, and always remember that caring matters.